first to make sure that he can do it. You know, before you start any exercise, you're supposed to have your heart checked.
Got to be heart healthy. Hi, B.
How you feeling, B?
I'm trying to stay as calm as possible. I mean, think about where I'm at, Dan. I'm hooked up to a heart machine, and there's a bright light in front of me. I feel like I'm looking down a tunnel.
Well, and
that's freaking me out right now.
Don't go to the light.
The problem is whenever you put on a
Don't go to the light.
Whenever you put on a hospital gown, it makes you feel like anything could happen because it gives you free access to all the physicians there.
Yeah. Well, you know what's funny is I bet you've never put on a hospital gown with this many people around. Yeah, turn around. There's Jess, there's Molly, Dr. Mills. Yeah, all these people were here while I'm putting my hospital gown. Have you ever done that before, Dan? Yeah, that'll make your heart go up. Yeah.
I'm going to look for those pictures on Twitter.
Okay.
And when I woke up,
Doc, how you doing this morning?
I'm doing very well. Nice to see you. Welcome to our hospital this early morning.
Thank you. 9 to 1 p.m. this Saturday is the heart fair. I got to ask you, what are you hoping people take away by coming to the fair?
Perhaps the most important thing I would like everyone to take away is that heart disease is perhaps the most important part of your overall health, because that is possibly the thing that most of us will pass away from ultimately. And the most important thing is we as an individual can take responsibility for our own heart health by applying the things that we learn when we come to the heart fair this Saturday.
Okay, I'm going to lay back and we're going to do a EKG reading, and then you can tell me, so what does this help you look for in a person's heart?
Yeah, Jeff here is going to do the EKG right now, and this EKG gives us all sorts of information about your heart, about your rhythms. It gives information about whether your heart is too big or too little, information if you've had a heart attack or if you are having a heart attack, all sorts of things we can learn when we get this electrocardiogram. So go ahead.
So are there different variables in this EKG? Is it just the beat of the heart, the rhythm of the heart? What exactly are you looking for?
Yeah, as you'll see as it comes out here, we actually look at 12 different leads with the electrocardiogram, and from that we can look at all different sort of aspects of the heart. Certainly the beat of the heart is an important aspect of it. And
what do you see?
What I see here is you have what's called normal sinus rhythm, and this normal sinus rhythm means your heart is beating normally from a rhythm standpoint, but interestingly it's got something called left axis deviation, so that means your heart is just maybe a little bit big and it's angled a little bit more. That might be because of your body size, and it might not mean anything real bad, but in general your heart looks pretty good.
Dan tells me that all the time. Every time we try to get in his car, he goes, I don't think you'll fit. It's because of your body size. Yeah. Thanks, Dan. Looks like you and Dr. Milstein have been hanging out together. I do appreciate that.
These doors don't open wide enough.
Here is his electrocardiogram. I guess since he's approving it, there's no HIPAA violation.
Now, Kim, last question, because we're out of time. Will people be able to get an EKG on Saturday, or will they be able to get other things that'll give them information about their heart?
If I understand correctly, they will be screened, and if they are at risk for heart disease, they'll get an EKG, and I will be there to read it personally.
Doc, thank you so much. Always a pleasure hanging out with you. This is the only time I like to be half naked.
That's right. You're doing great.
We'll be back with more.
All the way naked.
No, not all the way.
I see.
Less is more, right?
A lot more.
Wow. Who knew Groundhog Day was going to